were hearing some of your presentation earlier, which is you've been looking at discrepancies and the relationship between expenditure and mortality. But tell me, what have you actually done here?
Yes, actually, what we have done is we were interested to see what's the effect of health expenditure on cancer outcome. So for this, we saw that the European Union was a very interesting model because we have different countries that they are supposed to have equivalent health systems because they have these agreements of standardization of health systems in the European Union. But the systems are managed by the governments, by the national governments, and they spend money in a different way for historical reasons. So what we did was compare the expenditure with the cancer outcome.
And so what is the relationship that you've been able to pick up here then between outcomes and expenditure?
So what we did, we used data from a trustable database. So we assessed the database of the World Health Organization, the World Bank, and the International Monetary Fund. And then we extracted data regarding incidence and mortality of cancer, and we did a division between these two indicators to see what was the percentage of patients dying after a cancer diagnosis. And then we, like a percentage. And then we compare this with the health expenditure, and you see that there's a very significant association between these two variables. So if you take, for instance, countries that spend around between $1,000 and $2,000 per capita, the total cancer mortality of this, the percentage of mortality is around 60%. And if you go up to $4,000 per capita, the mortality is as low as 40%.
And did you look into where this money is being spent? Like what types of spending is going on between these different countries?
This is a very good question. Actually, we had we tried to look for cancer budgets in specific, but this data is not uniformly collected. So if we would do this, it would limit our ability to make comparisons. So we use the total health budgets of each country.
And is this is it a case of let's just keep spending more and more money and we can just continue to get these rates of cancer mortality down, or is there a threshold cutoff?
Yeah, this is a very good question actually, because what we see is a theory like in economy. They say that the additional benefit or the marginal benefit. I'm not really sure the specific name, but each dollar that you spend, you increase, but the subsequent dollar, it increases less than the previous one. So if you spend in 1,000 and you increase to 2,000, you gain a lot. But if you spend 4,000 and you go to 5,000, you don't gain that much, because we are human beings. So in a way or another, we end up dying. So there is a limit. Which is the limit? We cannot tell by our research.
And what about costs here in the different countries? Is there, I mean, do costs play some kind of role here? Is it potential for the more expensive treatments are in certain countries that can influence outcomes?
Yes, this is a very good question as well. We could not tackle this question with our research, but we are doing subsequent work to see what is the uptake of drugs, of new drugs, in each specific European country. So we imagine that yes, the more you use new drugs that save lives, the better is your outcome. But this is for the future. I guess in 1 year we have this result.
So what are the important conclusions to be made now then, coming out of your data?
Yeah, from our data, what we can tell for sure is that the more you spend on health, the less the patients die after a cancer diagnosis. This is the bottom line conclusion of our article.
So going forward from here then, what's next?
So now we are using, we use this European model to evaluate the impact of health care and health expenditure. Now we are going to use the trastuzumab as a drug model to see how, because this is a drug that has a high acquisition cost, but it saves life. So we want to see how this drug can be used and in which extent it's been used in the European Union.